Hello, everyone. I have 2 o'clock, so let's get started. Good afternoon. I am Chris Cain, Executive Director at CPWR, and I'd like to welcome everyone to today's webinar on an update on COVID-19 vaccinations and questions and answers with CDC's Essential Workers team. This is the 18th webinar so far in our CPWR NIOSH COVID-19 webinar series for the construction industry. You can access all recordings from the entire series through a playlist on our YouTube channel. We are excited to partner with CDC's Essential Workers team to bring you the latest updates on COVID-19 vaccinations and the construction industry. This is our second webinar on the topic of vaccines. So if you missed the first one, Jess will drop a link in the recording, a link to the recording in the chat. Captain Lisa Delaney will be presenting tonight. Lisa is the Associate Director of the Emergency Response and Preparedness Office at NIOSH, and she leads the Essential Workers team on CDC's COVID-19 Vaccine Task Force. We will then open the floor for some questions and answers. Dr. Doug Trout, Chief of the Hazard Evaluations and Technical Assistance Branch at DFSE NIOSH, is here to lead us through some discussion. We did receive a number of advanced questions through the registration process, and we'll address those first, followed by live questions as time allows. Please type your questions at any time in the Q&A box on your screen now. Any questions that we don't get to will be used to inform future webinars. With that, I'd like to go ahead and hand it over to Captain Delaney. Thank you, Lisa, for joining us. It's yours.
Sure. Thank you, Chris. It's a real pleasure to be here today. I think this is one of the most important activities within our Essential Workers team is this outreach to share important information about the COVID-19 vaccine. So I hope that you find this helpful, and I'll just go ahead and get started. Next slide. Yeah, it's been 1 year since COVID-19 infections were first identified, and there are now multiple COVID-19 vaccines that have been developed and put through clinical trials with the support of the U.S. government. So far, we've received FDA emergency use authorizations for 3 vaccines, and last week marked a milestone in the administration of over 100 million doses. And as you can see, this week, we now have over 113 million doses administered between the three vaccines that are offered. There's actually, within most of these vaccines are being allocated to jurisdictions, but there's a small percentage that are being allocated to certain federal agencies. And so to the right of the slide is information about the dissemination of and uptake of vaccines for federal employees. Next slide. So I just really want to start out this presentation with the most important message is that vaccination is a safer way to build protection. Getting the virus that causes COVID-19 may offer some natural protection known as immunity, but experts don't know how long this protection lasts, and the risk of severe illness and death from COVID-19 far outweighs any benefits of natural immunity. So COVID-19 vaccination will help protect you. Next slide. So as I mentioned, we currently have 3 vaccines that are available and have FDA's emergency use authorization. The Pfizer-BioNTech, which is 2 doses, and those doses are given at least 21 days apart. The Moderna vaccine, which is also 2 doses, given at least 28 days apart. And then the newest vaccine on the market that's available, and that came out earlier this month, so this is a really exciting month, Johnson & Johnson Janssen's 1-dose vaccine. So all of these vaccines were tested in tens of thousands of adults from diverse backgrounds, including older adults and communities of color. And all of them have been proven effective at preventing serious illness, hospitalization, and death from COVID-19. It is unknown, however, though, how long protection from these vaccines might last, and that's partially due to the fact that this has been a very rapid process of development. So we just haven't vaccinated people, and enough time has not passed for us to be able to have that data available to look at that long-term immunity that's going to be conferred from vaccination. Next slide. So I want to talk a little bit about the different technologies that these vaccines were used to elicit immunity. The first two, the Pfizer and the Moderna, rely on messenger RNA to carry out which carry the genetic material that teaches our cells how to build that immunity. So basically, they carry just a snippet of coding that tells that gives the cells information on developing the spike protein, and the spike protein is what is then displayed by the cells that elicit that immune response. So it triggers our body to develop antibodies that were going to protect us against SARS-CoV-2 virus. The second platform, next slide, are viral vector vaccines, and that's the J&J Janssen vaccine. So vector vaccines contained a weakened version of a live virus. In this case, it's an adenovirus. It's not COVID-19, the virus that causes COVID-19. And this also contains genetic material from the virus that causes COVID-19. So once the viral vector is inside our cells, the genetic material gives the cells instructions to make a protein, and that's a protein that's unique to the virus that causes COVID-19. And using those instructions, our cells make copies of that protein, and that, again, prompts our bodies to mount that immune response. But it's important to note that this is a harmless piece of the virus. It's not live virus that's part of this vaccine. Next slide. So like all vaccines, COVID-19 vaccines have been rigorously tested for safety before being authorized for use in the United States. The vaccine technology has been well studied for decades. The COVID-19 vaccines do not carry a risk of causing disease in the vaccinated person. That's delivered by the COVID-19 vaccines does not affect or interact with a person's DNA. Next slide. So we realize that you may have concerns about the safety of these first COVID-19 vaccines because they use new technology. These COVID-19 vaccines were developed based on years of research. The mRNA technology is new, but it's not unknown. And the mRNA technology has been studied for decades in vaccine trials for influenza, Zika, and rabies. And scientists began creating viral vectors in the 1970s. Another critical piece has been the investment in manufacturing, even before COVID-19 vaccines were proven effective. So we didn't skip any safety or steps in the process of receiving these use authorizations, but the steps were done in some cases in an overlapping fashion. So the U.S. government and vaccine manufacturers invested millions of dollars to scale up the vaccine production while the clinical trials were in progress. So we were able to compress that timeline of availability as a result. Next slide. So I wanted to address some of the key facts about COVID-19 vaccination and some of the common myths that are circulating. So I think it's really important to building vaccine confidence in our workers. Getting vaccinated can help prevent getting sick from COVID-19. COVID-19 vaccination works by teaching your immune system how to recognize and fight the virus that causes COVID-19, and this protects you from getting sick. People who have gotten sick with COVID may still benefit from getting vaccinated. Due to the severe health risks associated with COVID-19 and the fact that reinfection with COVID-19 is possible, vaccines should be offered to you regardless of whether you've already had COVID-19 infection. At this time, experts do not know how long someone is protected from getting sick, again, after recovering from COVID-19. A third, COVID-19 vaccine will not give you COVID. None of the authorized and recommended vaccines or even the vaccines that are in development contain the live virus that causes COVID-19. So this means that a COVID-19 vaccine cannot make you sick with COVID. COVID-19 vaccines will not cause you to test positive on COVID-19 viral tests. I know that was a question that we've received. Neither the recently authorized or recommended vaccines currently in clinical trial will cause you to test positive on a viral test. Now, if you have a serology test that's looking for antibodies, you will test positive, and you won't be able to distinguish whether that was from a natural infection or from your vaccination at that point. So depending on when you have that, if you choose to do an antibody test. But, you know, those routine viral tests, you wouldn't test positive. Next slide. So the safety of COVID-19 vaccines is a top priority. So even before the authorization, the routine steps that are in place to evaluate and assess the vaccine safety were in place. So FDA carefully reviewed all of the safety data that's available from the clinical trials to make that determination and approval. And then secondly, CDC's Advisory Committee on Immunization Practices also reviewed all of the safety data available before that recommendation was in place. And like all other vaccines, after authorization, FDA and CDC are continuing to closely monitor the vaccine safety and side effects. So there are systems in place that allow both CDC and FDA to watch for safety issues. Some of them are existing systems. So the VAERS system, the Vaccine Adverse Event Reporting System, is a national system that collects reports from healthcare professionals, vaccine manufacturers, and the public of adverse events that happen after vaccination. But we've also stood up new systems to collect information, and one of those I'm going to talk about in the next slide is called the CDC VSafe program. Next slide. So the VSafe is a smartphone-based tool that uses text messaging and web surveys to provide personalized health check-ins after you receive a COVID-19 vaccine. So through VSafe, participants can quickly tell CDC if they've had any side effects after getting the vaccine. And depending on that, on your answer, someone from CDC may call you to check up and get more information. VSafe also includes a reminder for you to get your second COVID-19 vaccine dose if you need one, because as I mentioned before, the J&J only requires one dose. And so we encourage everyone who receives the vaccine to participate in VSafe. All you need to do is register. To register is to have a smartphone, and you can talk to your vaccine provider about enrolling when you get your vaccine. Next slide. The VSafe Pregnancy Registry has been established to gather information on the health of pregnant people who've received the COVID-19 vaccine. Pregnant women were not included in the initial clinical trials, although some women did become pregnant who were enrolled in those clinical trials and were able to learn from them. But this registry is in place for us to collect even more information about reports in the VSafe program related to women who are pregnant and get vaccinated. Next slide. Any of the currently authorized COVID-19 vaccines can be offered to people who are pregnant or breastfeeding. Based on how these vaccines work in the body, experts believe they are unlikely to pose a specific risk for people who are pregnant. However, there are currently limited data on the safety of COVID-19 vaccines in pregnant people, and that's because what I mentioned earlier, that they weren't part of those initial clinical trials. So there are clinical trials underway that look at the safety and how well the COVID-19 vaccines work in pregnant people. Vaccine manufacturers are also monitoring data from the people that became pregnant in the clinical trials, unbeknownst to them at the time. So those studies are ongoing, and as more information becomes available, we will be sharing that on CDC's website. Next slide. So last week was a really big week in terms of the response, and new information was issued to address fully vaccinated people. And so the link, how we define fully vaccinated is 2 weeks after either your second dose of the Pfizer or Moderna vaccines, or 2 weeks after your single dose of the J&J Janssen vaccine. So fully vaccinated people can visit with other fully vaccinated people indoors without masks or social distancing. Fully vaccinated people can visit with other unvaccinated people from a single household if unvaccinated persons are low risk for severe COVID-19 indoors without masks or social distancing. And fully vaccinated people can refrain from quarantining and testing following a known exposure to COVID-19, provided that they do not have any COVID-19 symptoms. Next slide. So for now, fully vaccinated people, though, should continue to follow all of those good public health precautions that we've been recommending throughout the response, including wearing masks and physical distancing. We still encourage the vaccinated people to avoid medium and large size gatherings and getting tested if you're experiencing COVID-19 symptoms. And of course, following guidance that's issued by your individual employer is also important, and following CDC and Health Department travel requirements and recommendations. So CDC will be, continuing to assess our existing recommendations in light of vaccination status, and additional information will be forthcoming once we have more information to share. Next slide. So COVID-19 vaccination will be an important tool to help stop the pandemic, but it continues to be one tool in the toolbox. While COVID vaccines appear to be effective, additional preventive tools remain important to limit the spread of COVID-19. And the combination of getting vaccinated and following CDC's recommendations to protect yourself and others will offer the best protection from COVID-19. So washing your hands, avoiding close contact, covering your nose and mouth with a mask, cleaning and disinfecting frequently touched surfaces, all of those will help stop the pandemic and require us to use all of the tools that are available. It's going to take time to vaccinate all the people living in the United States. And while the vaccines are being delivered, it's important that everyone continue to take all the steps available. Next slide. This has been a monumental effort to distribute and administer vaccines across the United States. I mean, as I mentioned earlier, we have over 100 million doses administered. And this is for a disease and a virus that was only identified in early 2020. So it's really a remarkable feat. And initially, because the focus in the early phases of distribution focused on the priority populations of healthcare personnel, people who lived in long-term care facilities, and public health clinics, the distribution was very focused to target those audiences. But now that we are broadening recommendations for who can receive and who's eligible to receive vaccination, we're able to employ a whole host of distribution pathways. And so pharmacies, doctors' offices, mobile units, all of these tools that we have in our toolbox to vaccinate are going to become important and are being leveraged to ensure that we are reaching as many people as possible to make the vaccine available. Next slide. As I mentioned, the Johnson & Johnson vaccine became available earlier this month, and because it's a single dose, there may be some reasons why this might be attractive vaccine for certain populations. So this could be great for mobile or pop-up clinics where you may not be able to guarantee a return visit. It's good for newly established vaccine administration sites. There's a benefit of just in the handling. This vaccine does not require a freezer to be part of that storage process. So it does make it a lot easier to move around and reach mobile locations. It's also great for people who want to be fully vaccinated quickly. There may be challenges of being able to return to a vaccine clinic in 21 to 28 days after your initial vaccine, like it's required for the other two mRNA vaccinations or vaccines. So it can be convenient for people who don't want to return or can't return. And again, also for mobile populations or homebound populations that can be difficult to reach. Next slide. So we've received a lot of questions regarding essential workers and who's included in those initial populations. So shown here is a broad list of frontline essential workers that were prioritized under the Advisory Committee on Immunization Practices Phase 1B of COVID-19 vaccine allocation, as well as those that were listed in the essential workers prioritized list for Phase 1C. So this represents a large number of workers, just the frontline essential workers in the left column, which includes first responders, people in education, food and agriculture workers. I'll let you, read that for yourself. That's 30 million people. And then if you look at the other essential workers, that consists of 57 million workers, ranging from transportation, logistics workers, food service, energy, media, and public safety. I know that the construction industry has had questions about where they fall in line in this priority list, and I think most construction workers should be considered in the ACIP Phase 1C group. It's important to note that while ACIP makes these recommendations on vaccine prioritization for jurisdictions when vaccine supply is limited, jurisdictions have the final say on how vaccine is distributed to their population. And it's really not meant to be, the moving between phases can happen, can be overlapping, so you don't have to complete vaccinating everyone in one phase before you move to the next phase. And we're certainly seeing that play out across the country, that there's different decisions being made that can be a little confusing for folks to know, where each individual state is at in terms of who they're prioritizing. Next slide. So one way that we've tried to be clear, make it clear, because there's lots of different lists that are being developed that talk about essential workers. CDC recently posted information to help better interpret the different groups that are defined both by CDC and ACIP. And so what we put together is this interim list of categories of essential workers mapped to standardized industry codes and titles. So the more detailed listing by CDC includes a broad array of workers and occupations who support the construction, maintenance, or rehabilitation of critical infrastructure. Next slide. So there are many potential challenges for vaccination of essential workers. A given jurisdiction may have a large number of frontline workers to vaccinate, and that may require a sub-prioritization. State and local health authorities may need to sub-prioritize vaccination in that case. Workers may work in one state but live in another, and a great deal of coordination and planning may be required to take advantage of the timing when staff are eligible to be vaccinated. Transient workforces or workers whose jobs involve interstate transportation may have difficulty getting that second dose, and that's another reason why that Janssen and Janssen one-dose vaccine would be a good option. Next slide. So given the variety of industry sectors included in the essential worker category, there are special considerations and challenges that jurisdictions need to be aware of in vaccinating these populations, and that's one of the roles that our team within the CDC response is playing, is to try to bring those concerns and have some discussions about how to address those challenges that we're seeing. Some workers may have concerns about vaccine safety. There is a need for culturally appropriate vaccination information in multiple languages. I know in what we learned in meat and poultry manufacturing facilities, and some of these larger facilities, there are hundreds of languages spoken just in one facility alone. So having it in culturally appropriate information and culturally appropriate terms is very helpful. Rural areas have limited access to healthcare and health providers, and they require targeted strategies for vaccine implementation. Preferred methods of communication may be different for different groups. I know my mom has not really embraced technology, and so she really is a type of person who wants to pick up the phone and talk directly with a pharmacist, where I'm much more comfortable getting online and looking to see where I can enroll or get information. So people want to have different ways that they want to have communication shared with them. And we want to rely on community leaders to serve as trusted sources for information. We know that hearing from a federal agency may not be what's going to move people from being hesitant about vaccine to having vaccine confidence. They really want to hear from their community leaders, whether it's a union president or a religious leader in their community. There are also some missed days that may occur due to post-vaccination side effects, and that's we're hearing from workers is a concern, and may increase hesitancy or willingness to get vaccinated because they don't want to miss a day of work, and not missing a paycheck can have a big impact to their family. Critical infrastructure employees have an obligation to manage the continuation of work in a way that best protects the health of their workers and the general population. Next slide. So making COVID-19 vaccination part of your workplace wellness program offers many benefits to you and your employees. To keep your workplace healthy, consider offering free on-site COVID-19 vaccination at your business location. You know, I like to use a story of why it's so important and why it's successful to have these workplace vaccination programs. During the Ebola response, which seems, you know, years ago now, I was busy responding, and I was able to get the seasonal flu vaccine because CDC offered it, and all I had to do was walk down the hall. It was very convenient. So that same flu season, my children didn't get vaccinated until January, which is pretty late in the season to be vaccinated, because it was difficult for me to pull them out of school, to arrange a doctor's appointment and miss work. And so having the convenience factor can help increase workers' willingness to get vaccinated, and having these on-site programs is one way to overcome that. So employers should consider implementing a workplace vaccine program, and when you're doing that, it's important that you contact the health department in your jurisdiction for guidance. The planning process should include input from management, human resources, employees, and labor representatives if you have a labor union. Other important preliminary steps include obtaining senior management support, identifying a vaccine coordinator, enlisting expertise from the local public health authorities, occupational health providers, and pharmacies. It's certainly, you know, it's not something that can happen overnight. Employers should offer the vaccination at no charge and during work hours, and they should also offer flexible paid leave policies for those workers that may experience post-vaccination symptoms. Next slide. So if you're hosting a vaccination clinic at your workplace, if that's not possible, and we know that may not be possible for all employers, consider steps to encourage vaccination. You can encourage vaccination by providing information to your workers about where they can get the vaccine. I know that it's a pretty overwhelming process, and so people may be discouraged. And so there's a role that an employer can play in helping employees know where they can get vaccinated. And you should be flexible in your human resource policies, establish policies that allow employees to take paid leave to seek COVID vaccination in the community, and support transportation to off-site vaccination clinics. We've heard that as also a barrier to getting vaccinated is lack of transportation. Use promotional posters and flyers to advertise locations offering COVID-19 vaccination in the community, and those posters can be displayed in common areas like a break room or cafeteria or high traffic areas. And post articles in company communications, newsletters, intranet, emails about the importance of COVID-19 vaccination and where to get the vaccine in the community. And I have a slide about where to find resources that can be foundational for that information that you communicate to employees. Next slide. So I want to just talk a little bit about our team, which we established, I think, late December, early January. Within the vaccine task force, we established the essential workers team, and our mission is to focus on vaccine implementation for essential workers through linkages with workers, industry, labor, and other stakeholders. Our strategic efforts are focusing on disseminating information to enhance vaccine confidence in essential workers, and then support the jurisdictions to implement vaccination strategies for essential workers. So there's a really complex structure in place within CDC to help manage and provide support to the jurisdictions. We have regional coordinators that have direct line communications with the jurisdictions, and so we're hearing very firsthand, you know, what those challenges are, and we're raising awareness and sharing information and tools that we've created to help promote and raise awareness of the importance of vaccinating workers. Next slide. So this is an exciting time in the vaccine implementation. So we're really excited that we have these vaccines available. We know it's challenging, and we're gonna hit some roadblocks along the way, but we're in this together. We want to work to find solutions with you and overcome those obstacles. It's so important that we're able to engage in this way to hear directly from you what your challenges are, where are the gaps in messaging, how can we help you with your challenges in implementing vaccinations. This is an important tool that we have, but we're not ready to throw in the towel on all of the other important public health measures that are in place to help protect us, like masking, social distancing, hand washing, and even monitoring post-vaccination status. But we're in this together, and we remain dedicated to helping you with your needs. Next slide. So COVID-19 vaccination can protect you, your family, your friends, and your community. We encourage you to choose to get vaccinated and participate in the VSafe program to help monitor the side effects of the vaccine. Please share your experiences with your coworkers, your friends, and family, because like I said, it's not, hearing it from a friend and learning about their vaccination experience can really help build vaccine confidence in your community. It's important to show that vaccines, the reason that we get vaccinated is not just to protect us, but to protect our family and our community. And so everyone has a role in playing in increasing vaccine confidence. So I think with that, that concludes my formal remarks, and I'll turn it over to Doug for the Q&A session.
Great. Thank you, Lisa, so much for your great presentation and all that information. And it is a lot of information, partly to reflect the fact that there's a lot of work going on related to this by Lisa and many, many others. But so we have received questions ahead of time, so I think I'd like to start with those. We have been answering some questions in the chat, so I hope that's been helpful, but I'll go right into the questions, Lisa. Will there be advocacy or special considerations for vulnerable populations such as Hispanic groups to be prioritized to get the vaccine, since they have been among the groups that have been affected to some of the greater extents by COVID-19?
Yes, I think vaccine equity, ensuring everyone has the same access to vaccines, is an absolute priority within the overall vaccination program. CDC is working at the national, state, local, and community levels to address those barriers to vaccination in communities of color and other high-risk groups. And so, some examples of that, CDC recently provided funding to jurisdictions to support COVID-19 vaccination. And in the agreement, CDC indicated that at least 10% of the total funding received by each jurisdiction must be allocated for high-risk and underserved populations, including racial and ethnic minority populations. We have lots of materials that are been developed, specifically a guide to increase COVID-19 vaccine uptake among members of racial and ethnic minority communities. And really, it's using those community-driven strategies. Hearing from CDC may not be what is going to build confidence in this group. It's really pulling together those critical community partners to increase confidence and uptake of the vaccine. So there's a lot of efforts underway and a huge focus on these communities to help build trust and improve vaccine uptake.
Yeah, thanks. So on to the next question. So what is the required quarantine for a vaccinated employee if they've been exposed to a COVID-19 positive family member, or could be just COVID-19 positive acquaintance?
Mm-hmm. So for fully vaccinated people, and that fully vaccinated isn't from the time that you received your last dose, it's 2 weeks past that last dose, whether you received the 2-dose Pfizer or Moderna, or the single dose Johnson & Johnson. If you've been exposed, but you remain asymptomatic, you do not need to quarantine after an exposure. So any fully vaccinated person who experiences symptoms, however, consistent with COVID, you should continue to follow CDC's isolation recommendations and get tested if indicated for SARS-CoV-2.
Yeah, thank you, Lisa. And here's a question that really I think you've addressed it partly, but I think this is part of the reason that you're doing this webinar. And what is the best way to approach the topic of vaccines with persons who may be hesitant about vaccines or people who may be anti-vaccine?
Yeah, I mean, so there's actually been some interesting information about that. So, people that are pretty ingrained and don't want to get vaccinated, it may be very difficult to change their minds, but there's a big group of people that are sort of in that middle, like wait to see group and that spectrum of vaccine confidence. So I think the best thing that we can do is share your experiences and share what you know with people. Some may not want information. Some may want more information about COVID-19 vaccines. It's a new vaccine, and some people have questions, and that's legitimate. So I think there's quite a bit of information on CDC's website. Some of it's very simple, plain language. So you can go onto our website to get information about our safety and the effectiveness of the vaccines. And I think just talking about your experiences and building that up in the community. If you've been vaccinated, share that with others and talk about, your experience. We also have an essential workers vaccine toolkit, which I'm not sure that I was able to talk about that during my prepared remarks, but we have a lot of great information in that toolkit, and that can be found on our website. So we have frequently asked questions, and we have all kinds of information about that you can customize yourself and tailor it to your workforce. So we have key messages, we have posters, we have a PowerPoint presentation that we freely want you to take and adapt to your workplace. So we don't want you to have to reinvent the wheel on messaging. So we've got social media messages already prepared and written up. We've got newsletter articles that you can adapt and put into your newsletter. So we highly encourage you to go access that and take any of that information, tailor it, and help educate your employees about how safe these vaccines are and the importance of getting vaccinated.
Great, thank you, Lisa. We have a question on what are the side effects of the Johnson & Johnson vaccine, but maybe more broadly, what are the side effects of the 3 vaccines?
Sure, yeah, the side effects are similar. So you may have some side effects when you get vaccinated, and that's normal. It is actually a sign that your body is mounting that defense that we want it to be mounting to help protect you. So some of the common side effects are pain and swelling at the injection site. But some people also experience more systemic effects that can include fever, chills, just being tired, and headaches. But those only last a day or two and shouldn't affect your ability to do daily activities. But if you do have more serious side effects, we would recommend that you talk to your healthcare provider.
So here's a kind of a 2-part question. I think we already discussed recommending or requiring vaccination. So I think we've discussed that, but can you comment again, Lisa? What are some of the things to think about when make the vaccination easy to get on the work site or readily available? What are things? What do you have to say about that?
Yeah, so it's critical that you partner with your local jurisdictions, which I know can be difficult if you're a national company who you then have to work individually with each state. But that's the way that the vaccination is rolled out. So we recommend that you work with your local jurisdictions to have conversations about whether you can secure vaccines for on-site vaccination, or if the better approach is to utilize some of the existing vaccination services that are being offered in the state. One great tool is Vaccine Finder. That's on the CDC website, and that has local. You can put search. You can query by your location, and it can tell you which pharmacies are available and offering vaccinations. So, it's really kind of a multi-pronged approach. I think that it can be overwhelming and a little frustrating for people to navigate the systems of how do you schedule or identify where to get vaccines, and it's different from state to state. So sort of understanding each jurisdiction's process for enrolling and their eligibility is key. So it's really kind of starts at that local level.
Yeah, and I'll just echo that. I think it really, the system is set up for states and jurisdictions to make the vaccine available. I think it's really encouraging from what I've seen across the country. There's more and more vaccine becoming available. And this is just anecdotal, but here in Ohio, later in March, the vaccine is going to be available through appointments that you can schedule to everyone 19 years of age and above. So, I know that's just for Ohio, but I think the point is that that type of thing is happening across the country. So I think it should be encouraging that, more and more vaccine is becoming available. And I think the key that Lisa said is to pay attention to your local jurisdiction, whether that's the county health department or the state health department or some other entity. So here's a question, Lisa, that also came in through the chat. How should employers or others handle employees that are experiencing vaccine side effects that are similar to symptoms of the virus?
Yeah, that's a great question, and that came up early in the response because healthcare workers, were the first to get vaccinated, and many healthcare settings had screening programs in place, and so they wanted to understand, how do we don't want to prevent them from coming in if they're just experiencing side effects. So there's published guidance that relates to this for healthcare personnel who may have signs and symptoms that are similar to COVID infection after vaccination. So I encourage you to visit, because that guidance would apply also for non-healthcare personnel. So in some cases, the symptoms of COVID are similar to the side effects that you might experience after a vaccination, like fever, fatigue, and headache. But in other cases, symptoms like cough, shortness of breath, runny nose, a sore throat, loss of taste or smell are not consistent with post-vaccination symptoms. And so those you would want to take very seriously. That could be symptoms of COVID instead. So I recommend that you review that document and really kind of understand the differences in symptoms that would be expected after vaccination versus ones that wouldn't be.
I agree 100%. And also the bottom line with some of these, a question like this is, if someone is feeling sick and it's unclear exactly what's happening, there's no substitute for following your usual practice for someone who might be sick. That would be to get that person checked out by their healthcare provider. Lisa, how should employers approach letting fully vaccinated employees work without masks while other employees will be told they must still wear them? I think you've partially addressed this question already, but it's an important question.
Yeah, so right now we're still recommending that fully vaccinated people should continue to wear a mask and follow all the other protective measures that like social distancing. I think one of the primary concerns is whether or not a fully vaccinated person may still contribute to transmission. So they may be infected, but not showing signs and symptoms because they've been vaccinated and they're able to, mount some defense. And so the role that they may play in transmission is still unclear. I mean, there's some promising information coming out, but again, we just haven't had, we just started vaccinating in December and January, so we don't have enough time to have all of those studies completed, but some of the preliminary data does suggest that there is a protective factor against asymptomatic infection as well. And so the role a vaccinated person plays in transmission is low, but we still want to wait and be cautious. So we're still recommending all of those practices.
Right. And here's another great question that I think you've answered, but I think it's worth going over again, and the data may still be being collected. But how long are the vaccines effective for, and how often will someone need to get the vaccine?
Right. Yeah, and I'm going to sound a little bit like a broken record in that we still need time for these the research and those studies to take place, and we need time, enough time from when people started getting vaccinated to be able to study them, to see that 4, 5, 6, 7, 8 months out, how protective is that vaccine. So we don't really know how long protection lasts for those who are vaccinated, but what we do know is that COVID has caused serious illness and death for a lot of people, and if you get COVID, you're at risk of giving it to your loved ones who may get sick. And so, vaccine is the safest choice. Experts are working to learn more about natural immunity versus vaccine-induced immunity, and we're going to keep you informed as all that new evidence becomes available. And the need for and the timing for a booster, that hasn't been established yet. So we don't currently have any recommendations for additional doses at this time.
And this is a question that has also been coming up in the chat. Very important, lots of important questions. Can people that have been vaccinated still make other people sick by carrying the virus?
Yeah. So we don't yet know whether getting the vaccine will prevent you from spreading the virus that causes COVID-19 to other people, even if you don't get sick. So you could be infected, but not showing signs or symptoms. So, we're continuing to update our website as we learn more information about the role. So I can say, like, the clinical trials, they were looking for, symptomatic cases. So they didn't study, that wasn't part of the clinical trials. So it's not, so we still, need to do more work in understanding the role of vaccinated people in potentially transmitting the virus.
Right, and thank you, Lisa. I agree 100%. And also, just to clarify, this question has been coming up in the chat, and so I just want to clarify that it's not the vaccine. It's not the vaccine that would make the person have the virus and be potentially infectious. So what the CDC is saying is that if a person is vaccinated, and as Lisa just mentioned, there are not quite enough data right now to know if they otherwise get exposed to the virus, then they may be asymptomatic and potentially, and this is what the data, what we're trying to learn more about, the virus could be transmitted from that person, but it's not because of the vaccination. It's separate from the vaccination. I just wanted to, hopefully that clarified that, because that did come up in the chat. I think you partially answered this one, Lisa, but it's another good question. How does the vaccine affect the reproductive system?
Right, and that's a great question. And I know this is one that's we've received many questions on how maternal safety. The COVID-19 vaccine, like other vaccines, works by training our bodies to develop antibodies to fight against the virus that causes COVID-19 to prevent future illness. So there's currently no evidence that antibodies formed from the vaccination cause any problems with pregnancy, including the development of the placenta. In addition, there's no evidence suggesting that fertility problems are a side effect of any vaccine. People who are trying to become pregnant now or plan to try in the future may receive COVID-19 vaccine when it becomes available to them. So it's really a choice that you, a pregnant person, should make in consultation with their physician. But right now, I think I had a slide or two about the VSafe program, and there are many people who are pregnant that have enrolled and are part of that registry. And some preliminary data shows, that there's, there's no evidence to suggest that there's fertility problems. And there's a lot more information on CDC's website if you want to do a deeper dive on that topic.
Okay, thanks, Lisa. Can an employer ask an employee if they have received their vaccination?
Employers can ask if you've received their vaccination. I think where it can become an issue with HIPAA or ADA is if you ask more detailed follow-on questions around maybe why you're not vaccinated. And so that's where you have to be really careful in understanding, have a plan for how you want to query workers, because there could be legitimate reasons why people are not getting vaccinated. They can have exemptions because of religious beliefs or because of medical reasons, such as being allergic to a component of the vaccine. So it's one of those things that I think you have to be really careful about how you proceed, but you can ask that question.
One more question. Are union labor representatives or safety professionals or industrial hygienists classified as essential workers? ACIP
used guidance on essential critical infrastructure workers that came from the Cybersecurity and Infrastructure Security Agency, CISA, to define the frontline essential workers as workers who are in sectors essential to the functioning of society and are at substantially higher risk of exposures to the virus that causes COVID. Because of this higher risk, ACIP recommended that frontline workers receive vaccine in phase 1B, with the remaining essential workers receiving vaccine in phase 1C. And so while ACIP makes recommendations on vaccine prioritization when vaccine supply is limited, it's really ultimately the decision of the jurisdictions on how they select and distribute vaccines to their population. So, we do have the interim list of categories of essential workers that is really nice to crosswalk with the ACIP categories as well as the CISA essential critical infrastructure workers. So I would point you to that document and really kind of trying to tease out the specific vaccines eligibility. But I would say ultimately, it is a state decision, and what we're seeing it played out is it really does vary by state and where that's and decisions that are being made locally.
Yeah, thank you, Lisa. And that ends the questions that we have prepared. I think we've been answering a lot of the questions in the chat box. And so, Chris, I think I'll turn it over to you.
All right, well, thank you, Doug. Thank you, Lisa. This has been incredibly informative, and I know there are more questions than we were able to get to. Those will be recorded, and we will do our best to either get the answers to those questions and send them out, or to address them in future webinars. Really informative today. I just want to say, Lisa, that it's a lot of questions and answers on this topic, and I know the information is evolving by the day. So I think you did an amazing job of where CDC is now with its Essential Workers Task Force, and really appreciate participation by CDC and NIOSH today. And with that, we'll wrap it up. Thank you, everyone, for participating and attending. Have a great day.